Good afternoon. My name is Dr. Amy Comander. The title of my talk is Lifestyle Medicine and Breast Cancer: From Risk Reduction to Cancer Survivorship. My objectives are outlined here. First, I will review the epidemiology and risk factors for breast cancer. Next, I will discuss the evidence regarding the role of lifestyle factors and breast cancer risk reduction. Finally, I will review the role of lifestyle factors in optimizing health, well-being, and outcome for breast cancer survivors. As an introduction, I think it's important for everyone to be aware that breast cancer is the most common cancer diagnosed in women worldwide. In the United States, each woman has a 1 in 8 lifetime risk for developing breast cancer, and that is about 12 to 13%. I should note that cure rates have been improving. Thankfully, these improvements in outcome are due to advances in treatment as well as advances with early detection through screening. This slide is the 2024 update in terms of cancer statistics in the United States. And certainly in the top panel, this illustrates new cases that are predicted for 2024. The bottom panel highlights estimated deaths from cancer for 2024. And since we are focusing on women's cancers, as you can see, breast cancer, unfortunately, is the most common cancer diagnosed in women in this country, with over 310,000 cases predicted for this year. Other cancers are listed as well. Lung cancer is the second most common, followed by colorectal cancer and then uterine cancer. In terms of deaths from cancer, this is highlighted in the bottom panel. Lung cancer is still the #1 cause of death from cancer for men and women in this country. Breast cancer is the second most common cause of death from cancer among women, with about 42,000 cases per year, followed by cancer of the pancreas. It's important to note that breast cancer incidence rates are actually increasing, as outlined on this slide. If you look at the top portion of the graph in pink, which focuses specifically on breast cancer diagnoses from 1975 until the present. And I should state that incident rates for breast cancer are increasing by about 0.6% per year. Why is this the case? Certainly, researchers are trying to understand this trend. It has been noted that there is more of an increase in women diagnosed under age 50, unfortunately. And there are many potential explanations, such as lifestyle factors, physical inactivity, alcohol use, environmental exposures, and body weight. I should state that obesity is more of a risk factor for postmenopausal breast cancer. And then in addition, another factor that may be accounting for this increase is the decline in the fertility rate that has been observed. I thought it was important for us to highlight general risk factors for breast cancer, starting for the ones we can't change, the non-modifiable risk factors, and then on the next slide, we'll talk about the modifiable risk factors, the things we can change. So in terms of non-modifiable risk factors, the greatest risk factors for breast cancer are being a woman and getting older. In addition, many other risk factors are outlined on this slide to include thinking about genetic risk factors. Many of you have heard of genetic predisposition to breast cancer, such as the BRCA1 or BRCA2 genes, which we can test for, and now many others. Family history of breast cancer, of course, is a strong risk factor. Having a prior breast cancer or a previous biopsy that showed some abnormal cells, such as something called lobular carcinoma in situ, which that is a risk factor for breast cancer. Other factors that play a role include race and ethnicity, dense breast tissue, hormonal factors as outlined here, and prior radiation to the chest before age 40, which is used to used to be used to cure certain types of cancer, such as lymphomas. The modifiable risk factors are listed here, and these include hormonal factors such as births, use of oral contraceptive pills, hormonal therapy after menopause, breastfeeding, obesity, specifically for postmenopausal women, physical activity, and alcohol use. So what about lifestyle factors? How do they play a role? So we do know that approximately half of breast cancers can be explained by known risk factors, such as the ones we outlined previously. And about 10% of breast cancers may be associated with family history and genetic causes. So that means about 40% of postmenopausal breast cancer risk may be related to lifestyle factors, such as obesity in postmenopausal women, alcohol intake, and physical activity. And I should note that obesity, unfortunately, is a risk factor for numerous types of cancer, as outlined on this slide. This is from the New England Journal of Medicine, actually from 2003, really demonstrating even 20 years ago, we were aware that excess body weight is associated with the increased risk of cancer for at least 13 different types of cancer. And unfortunately, obesity is also associated with increased risk of dying from cancer, specifically for individuals with breast, colon, and uterine cancer. So this is just a really important area to highlight, that this is an area that we as the healthcare community very much want to focus on and help our patients to achieve a healthy body weight. Again, this is another slide taken from 1997, which really demonstrated how increasing body mass index, or being overweight, is associated with an increased risk of postmenopausal breast cancer, as outlined on the panel here. Interestingly, for premenopausal women, being overweight or obese is not associated with an increased risk of breast cancer. So that's just an important observation to know, and we're trying to understand the factors that explain that as well. This slide is just further highlighting what I stated earlier, that we know that in the United States, there is an increasing prevalence of overweight and obesity. And so this is certainly a public health problem that many of us are working on to try to help address, to improve the health of everyone in this country. So where does lifestyle medicine come in, and how did I get interested in this as an oncologist? And I've defined lifestyle medicine here, which is really a field focused on using evidence-based lifestyle interventions to treat and prevent lifestyle-related diseases in a clinical setting. And really the goal of this field is to help empower individuals with knowledge and life skills to make effective behavior changes to address the underlying causes of disease. And lifestyle medicine is comprised of 6 pillars, which are outlined here, which seem kind of obvious, but I think it's really good, as I mentioned each one, to think about how am I incorporating the important tools to focus on each of these pillars in my own life in order to optimize health. So thinking about the role of nutrition, focusing on a plant-forward diet, the importance of restorative sleep, physical activity, substance abuse, avoiding excessive use of alcohol and other risky substances, managing stress, that's an important one, and then the importance of healthy relationships and social connection. So each of these pillars is absolutely key when we think about lifestyle medicine and our overall health. And they all play an important role when we think about cancer risk, and also how we optimize the health of individuals with a history of cancer. So I don't have time to go through all of these in great detail in this talk, but I did want to highlight, obviously, one that's very important to me, physical activity. So we know that physical activity has been shown to be associated with a reduced risk of cancer. And this is a helpful figure from the American Institute of Cancer Research website, which really highlights the goal is 150 minutes of moderate aerobic activity each week. And that can be broken up throughout the week. You could do 30 minutes 5 times a week. You could do 10 minutes 3 times a day, 5 times a week, walking, biking, jogging, whatever kind of gets your heart rate up a little bit, that does count as that 150 minutes. So we know that physical activity is so beneficial to helping reduce risk of cancer, and it's so important for individuals who have a history of cancer. Diet is also so important. We know there's so much information and misinformation out there on the internet, so it's important to be careful. But these are some recommendations from the World Cancer Research Foundation, American Institute of Cancer Research, and American Cancer Society, highlighting some key concepts, thinking about diet quality. What is the quality of the diet? Limiting sugary drinks, limiting alcohol intake. Certainly for women, no more than 1 drink per day, and it's best to really not drink at all. Limiting red meats, avoiding processed meats, limiting consumption of processed foods, ultra processed foods. We hear about that in the news now. Really important to limit consumption of these foods. Eating more fruits, vegetables, whole grains, and legumes, as shown in this pretty picture here of this salad. Weight control, we talked about why that's so important. And again, avoiding use of supplements unless your healthcare team specifically recommends it for you. I love that the guidelines also highlight the importance of community support. We know that making healthy eating choices is a challenge for all of us, and there are so many social, economic, and cultural factors that play a role when it comes to diet and physical activity. So if you can get your family and friends on board with any lifestyle changes you're trying to make, maybe eating more fruits and vegetables, eating more whole grains, getting more active, you're going to be more successful. I should note that organizations like the CDC have programs in place to help support and promote strategies in communities. So there's some great resources on their website too. And here are some other resources I wanted to share. I love this quote from Michael Pollan: "Eat food, not too much, mostly plants." If you remember one thing from this talk when it comes to nutrition. But again, the Harvard School of Public Health has this healthy eating plate, which I think is a great resource. The Lifestyle Medicine Organization has a different view of the plate, but it's the same concept, a whole food, plant-based plate. And I mentioned the American Institute of Cancer Research as well. We know that these factors play a key role in breast cancer risk as outlined on this slide. There are 10 recommendations from the American Institute of Cancer Research, which are very important for helping reduce risk of breast cancer and all other cancers. And many of these topics we've already highlighted, so I think it's really important to review this slide and see how you are incorporating these recommendations into your own daily life. And then finally, we know that adherence to these recommendations has been shown to decrease the risk of breast cancer and improve outcome in survivors. And this is just one of many studies I wanted to highlight showing that women who did adhere to these recommendations definitely had a lower risk of breast cancer compared to those who did not adhere to these recommendations. So these recommendations are summarized again here. And I think the key point to know is approximately 40% of breast cancers could be prevented by following these recommendations for these modifiable risk factors. And these factors are also really important for breast cancer survivors as well. So then the key question is, how can we empower individuals to make these lifestyle changes? And that's what I wanted to focus on a little bit more in the remaining part of this talk. As a breast oncologist, I see women who do have a diagnosis of breast cancer, and how can I help my patients optimize their health, well-being, and ultimately outcome? This slide really highlights the cancer survivor population in the United States as predicted to 2030 in the bottom panel, and you can see that thankfully we have a growing population of breast cancer survivors, close to 5 million in 2030, and we want to provide the best care for these individuals. Again, a cancer survivor is defined as an individual who has a diagnosis of cancer, and it really starts at that time until the end of life and includes survivorship includes so many aspects: physical, mental, emotional, social, and financial effects of cancer. And we really need to address all of these issues as healthcare providers. We know our patients go through so many different phases of treatment, so many different challenges, and therefore cancer survivorship care really needs to address the needs of the patient at each step of the way. This slide really illustrates the key components of survivorship care. Many of these, maybe if you've had a history of cancer, you know your doctors address these in clinic visits, but I would like to focus on the last one, promotion of healthy behaviors, which we know is so important. And again, American Cancer Society, American Society of Clinical Oncology have highlighted the important role of health promotion for breast cancer survivors, and you will recognize these recommendations: helping individuals achieve a healthy body weight, a focus on nutrition, a focus on exercise, and of course, smoking cessation. So these are very similar to the recommendations I presented earlier in the talk. And then that's where lifestyle medicine comes in again, thinking of these 6 pillars of lifestyle medicine and how they are so important, not only for those at risk for cancer, but those with a history of breast cancer or other cancers. How can we improve the diet, inspire our patient to get moving, manage stress, form social relationships, improve sleep, avoid risky substances? All of these pillars are absolutely important. I should note that a recent study published just last year in JAMA Network Open, a prominent medical journal, did show that individuals with a history of breast cancer who adhered to something called this lifestyle index score, which really focused on physical activity, plant-based eating, avoiding red meat, avoiding sugary beverages, avoiding alcohol consumption, avoiding smoking. Those who adhered to these healthy lifestyle behaviors the most had a significant reduction in risk of breast cancer recurrence and improved outcome from breast cancer. So this is, again, one of many studies highlighting the important role of adhering to healthy lifestyle interventions in order to improve health, well-being, and outcome. Finally, in the last few minutes, I just want to highlight that we have lots of exciting programs at the Mass General Cancer Center, which really work to help our patient population improve lifestyle factors. And this is a clip from our website, the Lifestyle Medicine Program at the MGH Cancer Center. And our mission is to really provide a personalized consultation, whether it's in an individual or group setting for individuals who are trying to improve overall health, well-being, and cancer outcome with evidence-based tools from lifestyle medicine. So you can go to our website and read more about our offerings. I should note that last year we had this amazing webinar series where we focused on all these pillars of lifestyle medicine that I just highlighted. And if you go to the Mass General Cancer Center YouTube site, you can actually watch our webinars. I will promise that they're fun and interactive. They're not just someone speaking at a computer like I am right now. Like the nutrition webinar, we have two of our oncology nutritionists opening up their fridge and their pantry and showing us what they actually keep at home and what they do to follow a healthy eating pattern. So that's just one example, but I really recommend that you check out this webinar series if you'd like to learn more about lifestyle medicine. And I will give a highlight that we are going to offer another webinar series this year, and we're so excited to get that started. In addition, as a breast oncologist, I started this program for breast cancer survivors called Paving the Path to Wellness. I launched this in collaboration with my colleague, Dr. Beth Frades, a number of years ago now, and it's really a wonderful group-based program to empower breast cancer survivors with evidence-based tools from lifestyle medicine in order to optimize health after completion of primary cancer treatment. It meets for 12 weeks. We now do it virtually, and it's really been absolutely wonderful. I'd say the greatest gift has been the social support and connection that develops among the participants, even in a virtual setting. So really excited about this great program. I should say that, again, the community has been great. This slide highlights a number of the opportunities that we've provided to help individuals get together and support one another, certainly outside the hospital. For example, this is a great adventure we had on a sailboat off the coast of Salem. And this was thankfully due to a nonprofit called Sailing Heals. And you can see how much fun everybody had here. So we look forward to more community building events. I will say that making lifestyle changes is certainly a challenge for everyone. And I want, all of us are starting at a different place. So we need to have some self-compassion. But I do love this quote from Lao Tzu: "A journey of 1,000 miles begins with a single step." So be kind to yourself and just take that first step. And that is a great way to get started, especially as we kick off 2024. Finally, none of this work in lifestyle medicine, the paving program, or as a breast oncologist in my day-to-day job would be possible without the most amazing team, many of whom practice what we preach. These are some wonderful colleagues who I work with at the Mass General Cancer Center at Newton Wellesley. Rochelle is one of our social workers. Diane's a nurse practitioner. Melanie is an oncology nurse. As you can see, they're having fun together, working out in the infusion room. And I just love this picture. It makes me smile every time. And the panel on the right represents some of our leaders from the Paving the Path to Wellness program. We couldn't help but make this fun collage when the Barbie movie was out and hot, and each of us made this fun little image. Mine says, "This Barbie is paving her path to wellness," but you get the idea. So we just have such a great team, and I think that's absolutely key in helping individuals adopt these healthy lifestyle behaviors. We are all a work in progress together too. So I've left my contact information on the bottom if you have any further questions or ideas or want to learn more about lifestyle medicine. Thank you for the opportunity to speak today.